Welcome to the Equine Vet Connect Podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect Podcast. Back here in the studio this morning. Dr. Caitlin, how are you this morning?
Good. How are you?
Good. Looks like you're we're caffeinated. This podcast is brought to you by looks like Caitlin's Coffee Cup and Dunkin'. So
Yep.
Yeah, Dunkin', if you're out there, you should really look at sponsoring veterinarians because just in general,
we running on Dunkin'.
I mean, we run on caffeine, you know. And Duncan, thank you for being there when we need you.
Yesterday was a 2 coffee day for me too, so
yeah, coffee's good.
Something.
I mean, I always think about people that don't drink coffee.
Sad. I don't know how you do it.
I don't either.
Couldn't
God
be
bless them. Yeah. So speaking of coffee, as I'm the king of segues. Speaking of coffee, today's podcast is on the white blood cell. Yeah.
Okay. I think that one's stretch.
I've decided you can literally make any segue if you go, speaking of so-and-so, and then change topics. And 90% of the people just kind of go with you. And then eventually they'll be, well, what? Wait. Huh? So, yeah. That's how we segue.
Okay.
Speaking of Dunkin', let's talk about white blood cells this morning.
Let's dunk into the bone marrow.
Oh, wow. That's a really bad dad joke.
I know. Anyway.
Yeah. So, all right. So we're going to talk about white blood cells today because that's, I feel like it's, we're always running CBCs and most horse owners out there, they're hearing about, we're going to get a CBC chem. Mm-hmm. We're going to look at the CBC. And we start calling them back and we start throwing out, we got all these white cells and
got a leukopenia with a neutrophilia and a monocytosis. Yeah. And they're like, huh?
Yeah. And like, what does that mean?
Right.
And, to us, it means a lot. It gives us a lot of information what these cells are doing. So when we're talking about sickness, a lot of times the white blood cell is who we're looking at.
Yep.
So let's dive into this. Like, we have white cells, but they got to come from somewhere. Mm-hmm. So let's talk about where those white cells come from.
Stem cells.
It's not just for treating lameness.
True. Yes.
Stem cells are cool.
Yeah.
It's like where everything begins.
Literally, yes.
The hemopoietic
stem
cell.
Yeah. So these guys are living in the bone marrow, which is why when you have like people that have leukemia, mm-hmm. they need these white cells. So they get a bone marrow transplant because they've got to.
Well, they have to kill them all first. When they have leukemia, their bone marrow is making too many of them.
That's right. Sorry. Other way. Yeah.
They have to go in and zap these progenitor cells and they give them new ones.
Yes.
In a very oversimplified form. But
a roundabout way, yes. But anyway, the bone marrow is where all these stem cells are hanging out. They're living. They're stored there. Mm-hmm. And when the body needs to make more, they kind of reach into that pool of bone marrow and that pool of stem cells, and they say, become what you want to become.
And if you remember our podcast on the kidney gives them the signal.
Yeah, it's good at that. But yeah, so you've got, it's these stem cells, you've got stem cells that can basically become anything that they want. So any cell in the body. But then as you kind of go up in a tier, you've got stem cells that are going to become red blood cells or white blood cells versus a kidney cell.
Right. Yeah, so they're called progenitor cells, and those progenitor cells are the ones that keep reproducing themselves, and they actually make these white cells that are floating around in the body. And we have specialized white cells, and then we have our generalized white cells. Mm-hmm. So, when we look at this flow into the white cells, because they can also make red cells, but we're not talking about those today. We're talking about white blood cells.
Although the red cell progenitor have fun names too.
They do. But today's podcast is on the white blood cells. Yeah. And we don't want to get sidetracked.
No, we're good at that. I'm good at that.
Yes.
Yeah.
So we're going to talk about those white cells today. Mm-hmm. So one of the first things we see, like we're going to kind of look at this through the eyes of when we do a CBC. Mm-hmm. The number at the top of the page on the white cells literally just says WBC or white blood cell count.
Yeah.
And that looks at all of them. And then we're going to look at what's called a differential. Mm-hmm. And when we say differential, that means what kind of white blood cells they are. And each one of these kind of has specialized jobs, which kind of clue us into what's going on.
Exactly. Yep.
And it's also very species specific as to what white blood cell they're going to predominate and what they're going to use. Mm-hmm. So it's kind of cool because like dogs and cows, they actually respond with monocytes. Horses and cats love a neutrophil. But those are their main cells. But we kind of break those down into, different categories. You get your neutrophils, you get your monocytes. We'll talk about it how a monocyte becomes a macrophage. Mm-hmm. You get eosinophils, basophils, lymphocytes. I love lymphocytes.
Lymphocytes are fun. Yeah.
So all those things, it's not just about the white blood cell.
Yeah.
It's which ones do we have?
Yeah. And in what quantities are they going up? Are they going down? What are they doing? Mm-hmm. Yeah.
Trends over time. Mm-hmm. So we get that first white blood cell count back. What cell do you go look at first?
I look at my neutrophils first.
Yes. I love a neutrophil.
Yeah. But we work on horses. So I look at my neutrophils and then after that, I'll kind of look at my lymphocytes and see, because those are kind of our two that tend to go in different directions sometimes. But I look at those and then kind of look at you have to pair your blood work with your overall clinical picture, like we talked about on the bloodwork podcast. But definitely look at my neutrophils, and I want to know, we have neutrophils that are what we call mature neutrophils, and then we have neutrophils what we call immature, or they have bands. And so when we have bands, that means that we've got an infection. Most likely we've got an infection because the body's pumping out these immature neutrophils to try and tackle this infection.
Our mature ones we call segs. Mm-hmm. So those are the ones that they have fully matured. They're ready to go fight the battle.
Yep.
I look at white blood cells like a little war going on, right?
Every time. Yeah.
Yeah. That's how I see it. And neutrophil, like if it's a segment of neutrophil, it has been through basic training. It is ready to go fight. Mm-hmm. A band that's a new recruit just hit boot camp. Like it's got to get developed.
He got drafted.
He got drafted.
He wasn't quite ready yet.
Not ready, but we're going to get him there.
Yeah.
So, when we're looking at those neutrophils, and like I said, we were talking about earlier, like the horse, they respond to everything with a neutrophil. Mm-hmm. If you want to know why they get foot abscesses, why they love to give copious, like if you ever see pus,
that's neutrophils.
Those are neutrophils.
Yep.
Those are neutrophils. That's why their pus is white a lot of times, because they're white blood cells. And that's basically what pus is like all these neutrophils have showed up to go fight a battle.
And they've just spewed out all this stuff.
And they're really cool. They're like Pac-Man, Mm-hmm. They're like got these little enzymes in there that kill bacteria.
Yeah. Yeah.
You got lysozyme?
Well, I was just going to say they're kind of like...
They're not true Pac-Man. Monocytes Pac-Man.
Right. I was going to say they're kind of reverse Pac-Man because they're throwing up on stuff rather than...
Yeah.
It's okay.
Yeah, the neutrophil, but it does have to, they do have to get vacuolated.
Yes, they do. Yes, this is true.
So when we're talking about this neutrophil, the first sign of a bacterial infection.
Yes.
The neutrophil is on the way.
Yes.
And it's kind of cool how they get there.
They're rolling.
Yes. Let's talk a little about margination and how they end up there.
Yeah. So neutrophils, they are in the bloodstream, just floating around, keeping an eye on things. When the body needs a neutrophil, it will basically send out a cytokine or a chemical signal, and the neutrophil picks up on that signal. And as it gets close to that area where that cytokine is, it starts to slow down because it marginates, or it goes to the wall of the blood vessel and it kind of sticks. And it starts to slowly tumble until it gets to where it wants to be, and then it goes out of the blood vessel.
Yep, it goes right through the blood vessel wall and right to where it needs to be.
Yep.
How cool is that?
It's wild.
So you get this little signal that goes out. It's like following the signal. It knows it's getting close. So like, let me get over in the right-hand lane. Mm-hmm. Gets over in the right-hand lane.
Gets in its exit lane.
And it's like, all right, jump off the interstate.
Yep, literally.
And then it shows up like, all right, I'm here. Let's tear some stuff up. Mm-hmm. And that's really the hard part about the neutrophil. It's not about stealth.
It's non-discriminatory.
No, it just blows up everything.
Yes, it's a nuclear bomb. It just.
I mean, I kind of equate it to the Marine Corps. It's like it's just going to take out everything. You know what I mean? Like it's going to make a mess when it gets there.
Yeah.
It's going to solve your problem, but it's going to make a mess. So it's job.
It's not very diplomatic or tactful. It just.
It shows up in droves. One or two never show up in the horse. It shows up in the thousands.
Large numbers, very large numbers, yeah.
And so these guys get in there and they find this bacteria. They eat a few of them, and then they have this cool little structure in there, this vesicle or vacuole. Got my beads mixed up. They have a vacuole. And that vacuole contains this little enzyme called lysozyme. And that lysozyme, once it's activated, it just dumps this stuff everywhere, and it kills everything it touches.
Yeah.
Good cells, bad cells, everything. Bacteria cells, it don't matter. It just kills them all.
Yeah.
It's pretty cool.
Yeah, it's they're very good at what they do. And like I said, they show up first and they just decimate everything. Which is why you can have tissue damage with inflammation, because it's, like I said, it's not just killing the bacteria, it's killing the good healthy cells around it too. Yeah,
it wipes out everything in its path. It's scorched earth. And then that in turn sends out more signals that cause more neutrophils to show up, and they get there and they're like, well, that guy's exploding, I should do the same thing. Yeah. And it just does the same thing. You don't even know why half the time, I think.
No, they're just like pew pew pew. Yeah.
And like I said, that's also what makes, I've always said horse is the ultimate overreactor, because if you've ever been around horses, they kind of freak out at gum wrappers sometimes.
Butterflies.
And half the time, the diseases we're dealing with and the infections we're dealing with aren't near as bad as the neutrophils make it. But they over-respond with neutrophils.
Yes.
And that's what really gets us.
Yeah.
Like, to use this, like, the example I always think about is like strangles in itself, the strep equi bacteria.
Not that big of a deal.
Yeah, it's really not that big of a deal.
No.
But the body's response to that thing,
big deal.
Yeah, that massive amount of pus that drains out of them that we find.
Yeah.
Yeah, that's all neutrophils, and they just way overreacted to the situation.
Horses are good at that, though. You think about every inflammatory type disease that horses get, and it just like goes and just elevates itself or escalates itself.
I mean, that's, I talked to my wife, she's small with it. I'm like, we're constantly just having to, we're constantly just trying to control this.
Yeah.
Like half the time it's not the disease it gets, it's just
the inflammation.
The inflammation, the body's response. And the neutrophils is one that causes that.
Yep.
It just wipes out everything.
Yeah. Which is why, like we always say, dilution is the solution to pollution. If you have a bacterial infection, if you're able to decrease the amount of bacteria and antigens that are there, then the body's going to have a less inflammatory reaction because there's not as much stuff there for it to deal with.
That's why if we can get to an abscess, we get it open and drained and get those neutrophils out of the body. Yeah. And they'll start getting better because we've decreased the amount of those neutrophils that are there.
Yeah.
So it really does help. So yeah, that's our friend the neutrophil. And like I said, it is the first responder. It's the first one on scene, and it has no discerning ability. Kill it and anything around it.
It just explodes.
I think the only one worse, I don't even know if we're going to talk about it here, but it's one of my favorite cells when you're dealing with a viral infection is an NK cell.
Oh, yeah.
Like this thing's called, we abbreviate the NK cell, but it's literally the natural killer cell.
That's its job.
And
kill stuff.
Oh, yeah. And the one I always think about is the video when we're talking about influenza, because influenza targets the trachea.
Yeah.
And these little signals go up on a cell that says, hey, I'm infected with virus. And the NK cell sees it, and it literally goes in and kills it and all of its neighbors. Like, you're guilty by association. Because
that one is a sniper.
Oh, it is?
Yeah.
But it takes out everything.
Yeah.
Like, because it's going to kill
it's not a great sniper.
No. Well, I mean, it is, but it gets rid of anybody that could. You're guilty by association with it.
That's true. Yeah.
And so that's what happens with flu is that NK cell shows up and it wipes out everything in the trachea because you were next to a cell that had flu. Well, you got to go too.
Yeah.
You don't get to hang out here anymore.
And then your throat gets all scratchy and inflamed.
Yep. And you have no cilia in your trachea. And yeah.
Then you got mucus and can't get it out.
So I'd probably say, but NK cells typically hunt alone.
Yeah.
Neutrophils show up in droves.
It's a party.
It's a party.
Yeah.
Like when they show up, it's not one. They're going to bring all their buddies.
And then everybody starts throwing up.
Yep. Everybody's buddies show up and they just start throwing up lysozyme everywhere and just destroy everything.
Yep.
Like it's kind of a wreck.
Yeah.
Like when they're there. But I mean, the good news, your problem's getting solved.
It is. And it also cues us into, like, because sometimes we have trouble finding where the problem is.
Right.
But if you show up and if you've got pus coming out of somewhere, well, there you go.
Well, and that's, one of the things we look at is if we have a really elevated neutrophil count or a really low neutrophil count.
Yes.
That's when the hunt starts.
Yes.
Where are neutrophils going?
Yes.
So that's really important because the first thing you do is look on the outside of the body. Lumps, swelling, anything like that.
Mm-hmm.
Outside the body, do we see anything? Nope. Well, then we go hunt. Where are you hiding?
Yes.
So we're looking
somewhere.
Yes. And the cool part is there's only 4 places they can be.
Yeah.
In the guttural pouch.
Yeah.
Thorax. Mm-hmm. Abdomen. Mm-hmm. If it's a mare.
Uterus.
Yep. So this is why your vet goes on a hunt. Like all of a sudden your white cell count's really weird. And you see him reaching over, grabbing a scope and an ultrasound.
Yeah.
Like, where's my scope? Where's my ultrasound?
Yeah.
Let me go find the neutrophil. You find the neutrophil, you find the problem.
Mm-hmm. That's true.
So that's how we hunt it down.
Yeah. Every time.
Find the neutrophil. It's like a little game.
My favorite, just on a histology standpoint, is the eosinophil.
Oh, eosinophil. They're beautiful.
They're beautiful.
They
look
truly
like
are.
little raspberries.
If you get a chance, look up a picture. Maybe Casey throw one up there for those watching on YouTube. But
horses make really, really pretty eosinophils.
Absolutely beautiful.
Yeah.
Where do we see it? Let's talk about where we see those eosinophils.
Yeah, so eosinophils are, like I said, they look kind of like a little raspberry. They have all these like bright pink little bubbles in them. And they come out with parasitic infections, allergies, things like that. Like I said, horses make really, really pretty ones, but they don't typically make a ton of them.
Right.
But they're very good, like I said, for parasitic infections, whether that's, intestinal parasites or, really that's...
Lungs.
Oh, yeah, lungs.
One of my coolest slides I ever had. And this was, I wish I'd taken a picture of it, but the horse had a cough.
Oh,
and did a trach wash on it.
Yes.
And I make this slide and I'm literally looking like, these are beautiful cells. What are these? Because you never get to see them.
Right.
And all of a sudden I realized like these are eosinophils.
Uh-huh.
So I got eosinophils on a trach wash. I know what I'm looking at.
Uh-huh.
I have literally got a lungworm infection.
Yeah.
And sure enough, a horse lived with a donkey. Donkey wasn't dewormed.
Yeah.
And I find the most beautiful cell, or I find the most beautiful part of the slide. I literally have a lungworm on my slide, and this thing is completely coated all the way around with neutrophils, like just attacking it. It was absolutely beautiful. I sent the slide off to a clinical pathologist and never got it back.
Oh, yeah. They kept that one forever.
Yeah.
Yeah.
I was like, you could keep
They're
it, but like, take me a
day.
picture.
Yeah.
Take me a picture.
What is it? What is it? D. Arnfeldi?
D. Carlos Arnfeldi, yeah.
Oh, gosh. Anyway.
It was so cool.
Yeah.
So cool when I saw that. And I'll never forget it. Top 5, number 1 cytology I've ever done. Mm-hmm. And I've done a bunch.
Yeah.
That one was the best. And like to actually see eosinophils in action, killing a pair, like they physically show up and surround this thing and just kill it.
Yeah. Yeah.
It is awesome.
It is cool.
Yeah.
They, but yeah, the allergies too. Like if you've got a horse that's super, super itchy, and their eosinophils are up, like you're
Get an allergic response.
Yeah.
It's rare we get that slam dunk on blood work.
Unfortunately.
When you do get it, it's pretty awesome.
It is, but it has to be pretty bad for it to show up that way. Because they, like I said, they make really, really pretty eosinophils, but they just don't make a ton of them.
Yeah.
Yeah, they kind of suck at making them. But they are helpful. They're not like I said, they're the prettiest ones for me to look at, but they're not the most helpful on our CBC most of the time.
Right. Now, one of my favorite cells is the monocyte.
Oh, yeah.
I love the monocyte. And monocytes to me are cool, right? Because you have a monocyte, and when it's, so we talk about what's the difference between a monocyte and a macrophage. If a monocyte is inside the bloodstream, it's a monocyte.
Yeah.
The minute it goes outside, so it marginates just like a neutrophil does, it ends up in circulation, it becomes a macrophage.
Right.
And this thing literally is like Pac-Man.
Yeah.
Like it's a true Pac-Man. It's going to get rid of a bunch of stuff, but it's going to be very neat and clean about it. It's going to go through it and it's just going to start eating stuff.
Yeah.
It doesn't like to really explode. It kills everything and then it just kind of goes away. Like someone will degranulate or explode, but most of the time they just eat and go away.
Yeah. Most of the time they're just eating stuff. And then if they digest something and they're like, ooh, hey, this thing, they throw up their little red flag and they're like, hello, immune cells, come and take care of this thing, please.
It's really cool because there are secondary, what we call APC, antigen presentation cells. But they eat something that's foreign and they're like, oh, this is bad. I need to let the world know about this.
Yeah.
Send up a flag.
Yeah.
And then your neutrophils show up. And
then it all goes to crap. But, Yeah,
your macrophage is like going along quietly, like cleaning stuff up and getting rid of infection nice and cleanly.
Yeah.
And then, neutrophils show up and and interesting enough, this is the cell that likes to show up in cows and dogs. They like a monocyte.
They love a monocyte.
Which is why I think they don't overreact near as much as horses do to disease. Because it's the monocyte that shows up and it very quietly just cleans things up. You
do get a monocytosis or an increased monocyte count in horses, but it's minimal most of the time.
Minimal. And usually that's late stage infection. This has been going for a while.
Yes. Whereas, dogs and cattle, their monocytosis is like sky high.
Yeah, they're just like the neutrophil in a horse. The horse gets sick, neutrophil count goes through the roof. Dogs and cows, neutrophils kind of hold, but man, the monocytes will go crazy. Mm-hmm. And like I said, monocytes are very clean. And the other cool thing to me about a monocyte, it's not just there when we have infection. These things are working all the time.
Yeah.
They're cleaning up bad cells that don't need to be there. Mm-hmm. They're cleaning up tissues. My favorite one, it's a highly specialized monocyte, and that's osteoclast.
Yeah. Yeah. I thought you were going to go for the ones in the liver, but.
No, like an osteoclast is so cool.
I don't know why I thought that. That's definitely a me thing, but.
Yeah, like I think about so an osteoclast is what is in bone that's constantly helping your bone remodel.
Yep, just cleaning it up.
Yes, it's like, all right, your bone, you're not healthy anymore. I'm gonna get rid of you because I'm gonna clean you up, and then I'm gonna send my construction crew in, the osteoblast.
Because they're not just taking care of infected cells or, like with a virus or bacteria. They're also just taking care of cells that have reached the end of their life expectancy or that are not following the rules that the cells are supposed to follow. So cancer cells, like early cancer cells, can be taken out by the macrophages. But there's specialized monocytes that go out into different tissues, and then we give them special names like osteoclasts, and but they just sit there and they just constantly clean up the cells and clean up the tissues.
When that cell's no longer good to us, the monocyte's like, I got this, and it just cleans it up.
Yeah.
Just eats it and takes it away.
Yeah.
They're so cool.
They are.
And like I said, this is where, like, if you want to see something that's really cool.
And they're big.
They're big.
Yeah.
And sometimes they get to, 4 and 5 nuclei, multinucleated.
Yeah. Oh, yeah.
Yeah, we may not get into that, but one of my favorite things to watch on a monocyte is, like, if you get a fracture. And when you first see that fracture, the edges are really, really jagged. But you start taking serial x-rays of that, and you'll actually watch, and this fracture line gets very clear and distinct. And it's very straight lined on an x-ray because the monocyte said, hey, I'm going to go clean all these cells that are messed up. I'm going to get rid of all this bad bone. The osteoclast is specialized.
Yeah.
And some macrophages come in there too because there's soft tissue that needs to be cleaned up.
Yeah.
But the two work together to create this nice, beautiful line.
And that's why we say if we're suspicious of a fracture, but we can't really perfectly see it, we say, hey, we need to, stall rest this horse and recheck in 7 to 10 days because that's when that happens and it shows up.
That's what I tell people. Like, I went to the hospital and they didn't see this fracture in me, but then I went back 2 weeks later and they saw it. That hospital missed it. It's like,
no, they didn't.
Second guy had an osteoclast helping him.
Exactly.
He had a little bit of help. That osteoclast showed up, cleaned up that line. But they're just they're like, they're just so cool.
They are cool.
Because they do it so well. They're like, I don't know. I just get excited about them. And like I said, I love how they clean up bone. I love what they do to bone. One day we'll talk about osteoclastic inhibitors and my hatred of them. But
oh boy,
we won't go there today.
That's a soapbox.
Because that's going to, never mind. I'm just not going to go there
derail.
Because that will get sideways so quick. But yeah, the monocyte, like I said, you got these progenitor monocytes. They produce these, and then when they get to tissue, it's like, okay, if I'm in bone, I'm going to be an osteoclast.
Yeah.
On tissue, I'm going to be a macrophage.
Yeah.
And I'm just going to clean the world up, and I'm going to do it quietly. Mm-hmm. I'm not looking for glory.
No.
I'm just going to quietly sniff around and just clean the world up.
Just a little worker bee in the background.
Yeah. So say thank you to your monocytes today, because like I said, they're clearing out precancerous cells. They're cleaning out cells that aren't any good to us. They're helping make your bones better. So
they are like the true little Pac-Man, though. They just run around and eat stuff. Yeah.
So yeah. So if you're here today, thank your monocytes. I'm sorry. I love them. They're
good. They're great.
They're so detail oriented. I think that's my thing. Is like when I look at the osteoclast and I look at how well they clean that fracture up.
Yeah.
To go from all these jagged edges to this nice, smooth, beautiful line. Mm-hmm. I guess I grew up a carpenter. So, like.
You appreciate a smooth, crisp line.
Yes.
Yeah.
Like it's beautiful what they do. I love it. So, yeah.
We forgot about our other lowly granulocyte, the basophil.
Well, I was kind of saving him.
Oh, okay. We can save him. We'll come back.
No, we're going to talk about the basophil because I was saving him to the end because this dude, he's a mystery. The equine basophil, if you find one, you take a picture and you send it to all your friends.
I never have.
I found one.
Really?
Yes.
Oh.
And it had a basal cell tumor.
Oh, well, that tracks.
That was I was looking at a horse the other day and something came up about they did a fine needle aspirate and they think it's a basal cell tumor and they did an aspirate and I think they found a basophil on there. I was like, if they found one, it probably is.
Yeah, because you don't find them.
You don't find them. Mm-mm. Don't find them.
I forget about them most of the time because we literally never see them.
Well, and this is the reason, when we talk about antihistamines in horses, mm-hmm. This is the reason they don't respond well to things like Benadryl.
Yeah.
Because basophils, that's where all your histamine lives. Mm-hmm. The bulk of your histamine, it lives in some others.
Yeah.
But these are like professional histamine producers. Mm-hmm. And because we don't have much of a basophil response, we're talking about allergies.
They don't really help that much.
No.
Yeah.
So antihistamines, this is why they don't work real great. Because again, a horse with an allergy responds with something besides basophil. So yeah, the basophil. We're not going to say much about him because.
Yeah, I mean, allergic and inflammatory responses, histamine and heparin, but that they just don't. There's not a lot of them. Horses just don't make them.
Like I said, you find one, it's like
play the lottery.
Yes, I call it like the what's that guy Bigfoot? He's like the Bigfoot of the horse.
Sam Squanch.
Yeah, he's old Sasquatch. I'm sure he's there somewhere, but we've never seen him. I mean, you can go an entire career doing cytologies I'm sure clinical pathologists see this a lot.
Well, because they're looking at, thousands of slides. But
even when they see him, I guarantee they call their friends and be like, hey,
guess what I saw today? Yeah.
Yeah. So you don't get to see him much. I remember when I was in vet school, we were doing smears and it's like, hey, everybody look at this slide because this is an equine basophil. It took us years to find it. So everybody kind of can look at this. It was something like that. You just don't get to see it very often. But but they're kind of really beautiful cells too.
They are.
They look like blackberries is what I describe them as.
They do look like blackberries.
Blackberries.
Yeah.
So let's talk about this cell. All right. So this is a really cool cell. It's getting studied a lot, but it is the lymphocyte.
Lymphocytes. Yeah. So lymphocytes are another type of white blood cell. And they are really what is driving your immune-mediated response. Mm-hmm. So when we talked about vaccines and we talked about, memory B cells and we talked about antigens and antibodies, that's these guys.
Yes.
Yeah.
They're the ones. This isn't a hard and fast rule, but when we talk about viral infections, these guys are
the ones we're looking at.
Yep, these are the ones that are helping us out here.
Yeah. I just had a case of a really high fever with no other clinical signs, and I ran my blood work, and I had a high lymphocyte count, and I was like, oh, hello.
Yes.
Viral.
That's what like I said, nothing's hard and fast in medicine.
But you look at trends.
But that's going to be the one.
Yes. You look at trends, and again, you pair this with your exam and your clinical history and all the things, and it can cue you into what's most likely going on.
And horses they're pretty good with these lymphocytes. Mm-hmm. But talking about the lymphocytes, you brought it up, like the memory B cells.
Yeah.
A specialized type of lymphocyte. These are the ones that memorize infection. Mm-hmm. And they're over there primed, ready to go. The body makes it. They store them someplace, and like, you hang out here. And if one of my macrophages out there says, hey, I just found this virus, mm-hmm. it's going to tell you. And your job is, I need you to start cranking out lymphocytes so you can start cranking out antibodies to this.
Yep.
You remember it. You're not going to make the antibody, but you're going to start making a whole bunch of yourself so you can start cranking antibody like it's your job. Mm-hmm. And this is the reason horses, their immune system's just like them. I just realized this. Because they have terrible memory.
They do.
So their memory for like people have great memory, which is why we're never vaccinated. We
get vaccinated when we're babies, and then you get vaccinated for tetanus once a decade.
Yeah.
And that's it.
And dogs, great memory.
Every 3 years.
Yeah.
Yeah.
But when you're talking about the horse, like this is why, like where we live, it's every 6 months. Mm-hmm. Because horses do a crappy job making memory B cells.
Oh, they're terrible.
They don't live long. It's crappy memory. Mm-mm. And I think this is important because we talk about titers and vaccines. Mm-hmm. Well, it's great to have a titer.
What does it mean?
Yes, because if you burn up all those antibodies, you need this other cell over here, this memory B cell.
Yeah.
You need him cranking out other antibodies, but he's got to replicate himself before he can do that.
And that takes time.
It takes time.
Yeah. And so basically, I look at it like the memory B cells, they're like a bank. They're like a catalog that you put in a safe. Mm-hmm. Horses, their safe catches on fire very often.
Yeah.
And they're gone.
They're gone.
So you have to replenish that bank and replenish that safe by vaccinating more often in horses because they just don't do a good job.
No, when you look at how cell replication works, it's binary fission. So I shouldn't say binary fission. That's more of a bacterial process.
Yeah. I was
No, but when it replicates itself, this isn't a fast process because it's an exponential growth.
Yes.
And you can't do it in minutes. It's days.
Yeah.
And so when you get in there, it takes a long time for them to get ramped up in producing cells so they can make the antibody. And we have to keep them alive during that time so the body can make the antibody to go fight the infection.
Yeah.
Because one of the things we've learned is viruses, the thing you run into is we don't have great antivirals. COVID taught us that. That's not something we're good at, is fighting virus. Never have been, which is why we have vaccines. Mm-hmm. And like I said, horses, crap memory.
Yeah.
It's terrible.
Yeah.
So that's why they're vaccinated so often, because they do these lymphocytes are not real great at that.
No, but when they do have them in enough capacity or enough, number, they're very good at what they do.
Yes.
But we just need to keep that population high and keep it active so that in the event that we do see one of these viral infections that are typically the ones that we vaccinate for are life-threatening.
Yeah, they're fatal.
Yeah.
They're definitely fatal.
We vaccinate so often to keep those populations of memory B cells high so that we can have enough plasma cells to make antibodies to fight those infections and keep us alive.
Yeah, we're not building these. We're not doing this to produce a titer. Mm-mm. That's not why we're vaccinating your horse so often. It has nothing to do with producing a titer.
Yeah.
It has everything to do with those memory B cells.
Yeah.
Everything to do with that.
Right.
So that's a specialized lymphocyte, memory B cell. Mm-hmm. And what's really cool too about lymphocytes is there's different types. There's CD4s, CD8s. Mm-hmm. There's all these different kinds in there, and they can tell you they give you so much information about what's going on.
Yeah.
And now downside, it takes forever to get them typed. So like if we're trying to solve a problem, we can't be like, oh, let's type these lymphocytes.
It takes a long time.
You got to have a lot of nerds in a lot of labs.
But, so your B cells are for basically your antibodies and your memory B cells. And then you've got your T cells, your T lymphocytes, and those are your helper T cells and your cytotoxic T cells. And then your regulatory T cells, which I don't think horses have a lot of those because the job of the regulatory T cell is to suppress the overreaction of the immune system. And horses, they just go full speed ahead most of the time. So.
Well, and that's the thing when we're talking about those helper T cells. They're the ones that also help to flag these cells.
Flag the neutrophils down.
Yep.
They put out those cytokines and they're like, hey, it's over here. Yeah. And then they just exit the highway.
And they also sit there and help mark, like, this cell needs to go away.
Yes.
So it's kind of like, think about if the cell's camouflaged and trying to hide. The T cell's one sort of flushes it out and is like, here, get this one.
Marks it with like bright red spray paint.
And then neutrophil comes on and is like, get him and all his buddies.
I think we talked about this before when we did the vaccine podcast, but like every time I think about the immune system and white blood cells and the whole response, it's like a sci-fi war zone in my head. When we decided to do this podcast, I was like, I think we need to make it a puppet show and just do like a battlefield.
It kind of is. Like, get some army tanks out here.
Yeah.
Because it is kind of that way. Well, and so here's the thing. Like, if you're listening to this podcast right now, when we show up and your horse is sick, you're seeing a sick horse. Literally, this whole scene is playing out in my head. So if I'm over there, like, kind of sitting there, and you're like, is he even paying attention? I am.
At the wall again.
But my whole mind goes to like this whole battle getting fought.
Yeah.
Inside, and like I'm seeing all this happening in real time, and I think that just showed how much of a nerd I am.
Well, but I mean, I love this because you put all the puzzle pieces together, right? Like I've got an SAA that's elevated. I've got patterns like leukocyte patterns on blood work. I've got a clinical presentation and a physical exam, and I'm like, ooh, okay, here's all my options. What's the whole picture look like? Where is it happening? What's happening? What stage of the infection am I in? Like, what do I need to do? Do I have all the puzzle pieces yet? Do I need to do more diagnostics? Do I need antibiotics? Do I not need antibiotics? Like, there's a whole smorgasbord of things going on. And the horse is just sitting there like, hi, I don't feel good.
Yeah. Which is why sometimes, like, we may run a CBC and we're like, it comes back. No, I'm like, all right, I'm gonna run another one of these in 24, 48 hours. Because what we're trying to figure out is which one of these cells is out there doing what. Mm-hmm. Because if we come in, let's say early stage infection, the body hasn't really ramped up and deployed everybody yet. Mm-hmm. We may have a normal CBC. We come back in 24 hours and all of a sudden our lymphocytes are like ramped up and rolling. It's like, okay, we're most likely dealing with a viral infection here.
Yeah.
And we got to go solve that problem.
Yeah.
And then the $1 million question was like, what virus is it? Like, we run some PCRs. We got about 10 of them we can find. A lot of these are just nondescript. Who knows what?
Yeah.
But then we know, like, all right, this is a supportive care game. Monitor for additional clinical signs, and we're following supportive care.
Right.
Now, we show up and run that second CBC.
And things are different.
And we got neutrophils going everywhere, either low or high.
Yeah.
Time to go on the hunt.
Correct.
Where are they going?
Yep.
Where are they hanging out at?
Yep.
That's where we get our satellite imagery out and go find.
And sometimes it takes time for that lab work to catch up to the clinical picture that you're seeing. Right. Because again, the lab work is just a snapshot in time. So we've got to kind of look ahead and see, okay, what's probably coming next in this pathway. And so, we'll go back and recheck that CBC. And I'm like, okay, this is more of what I expected to see yesterday based on my clinical presentation. So it's just catching up. It's showing us what's actually, is actually happening in there. Cause these things take time. It's not a immediate, thing.
Because we've got some of these white cells that are stored that we can immediately release. This is why we have lymphoid tissue.
Yep.
This is lymphoid tissue's job to kind of store some of these things and makes these things. But at first we may not see them. Yeah. And so this is where, like, I love the fact we have this SAA test now. That's an early marker of infection.
Yeah.
And so if we have a normal CBC, but our SAA is sitting there at like 500,
Mm-hmm.
I know I need another 24 hours. I need to get that second CBC.
Yeah.
Because I want to know which one of these cells is doing what.
Mm-hmm.
So I know where to go hunt and how I need to manage my treatment. Because
Right.
knowing which cell of these is involved gives me a lot of information.
Yeah.
So
Sure.
it's so cool.
It's a like I said, it's a giant puzzle, and but knowing what these cells do and where they go and how they function is it's just cool. And I wish when we did this we could like take everybody down the progenitor pathway on a microscope slide, because they're so pretty.
They really are.
Yeah.
Let's talk a little bit about there's one thing that, like, the lymphocytes, the other place they're involved is we can get lymphoma.
Right.
Which is one of the few, when we're talking about cancers in horses,
Mm-hmm.
lymphoma is one of the few, thankfully, one of the few cancers we really have to worry about.
Yeah.
But these cells will go rogue and they'll produce lymphocytes like crazy.
Yes.
And a lot of times it's because the lymphocytes have somehow in their programming decided it's going to target normal tissue in the body.
Mm-hmm.
One of the places we see this a lot is IBD, or inflammatory bowel disease.
Yeah, GI lymphoma is a very common thing that it's difficult to truly diagnose it in horses because you have to have a good biopsy to diagnose it, but we can be very, very highly suspicious of it with history, clinical signs, progression of disease, things like that. But when you get to the end stage, it finally shows up on your blood work, and you've got a lymphocyte count that is like through the roof.
70, 80,000.
Yes.
It's huge.
Yes.
You look at these slides, you'll do a blood smear, look at the slides, and the whole thing's just a giant coating of lymphocytes.
Yeah.
You're dealing with lymphoma.
Yeah.
And like I said, most of the time that's what we call an autoimmune, where these cells have now started to target the body.
Yeah.
Because it's kind of cool. All these cells are programmed like, this is what the good guys look like.
Yeah, this is self. This is not self.
So if you know what self looks like, anything that's not this, go kill it.
Yes.
And that's literally their instructions. But they're programmed to know what self is.
Yeah.
And with lymphoma, something happens where they get programmed that says, you know what, that GI tissue,
Bad.
that's bad.
Yeah.
And then it goes in and starts wiping out all of its, all the GI tissue.
Yeah.
Because it got programmed and said that's bad.
Yeah.
So that's, and lymphoma can attack other tissues. Just the most common when we see is that inflammatory bowel disease, that IBD is actually a form of lymphoma.
Yeah.
And these horses get weight loss, diarrhea, things like that.
Yeah. The and early in the stages of disease, the monocytes and macrophages, they take those cells out.
Mm-hmm.
When they're programmed inappropriately, they can go and take those ones out. But then at some point, they're overwhelmed.
Yep.
So
they're producing more of these rogue cells than what because again, the macrophage or the monocyte, they're not common, but they can't take them all out. They can't get rid of all the bad cells.
No, and they basically stop reading the rule book, and they just do whatever they want. So,
and that's really, if you describe autoimmune, if you wanted to like oversimplify autoimmune, that's when a white blood cell is no longer it has gotten messed up in its program to not know what self is.
Yeah. And so it starts attacking self like it's other.
Like it's bad.
Yeah.
So white cells great when you need them, but man, if they decide to fight against you, it's not good.
Yeah.
Because we're kind of limited, right? Like, here's some steroids so we can just suppress immune cells.
But then you're susceptible to infection, and then that takes you out, and then it's a difficult line to walk for sure.
Some of the other really cool drugs that people have for autoimmune conditions we don't get to use in horses because either the medicine's cost prohibitive, it doesn't work. Because that's the other thing. A lot of things that work in people will not work in horses for these autoimmunes. It has to do with what's wrong inside that lymphocyte.
Yeah.
Because these autoimmune drugs are very specific. We talked about those CD4, CD8s, and the T helper, like all those sort of things. They're very specific.
Yeah.
And so it's really interesting how
it all works or doesn't work, I guess.
Or doesn't work. But
Yeah.
when you really think about it, these white blood cells, they're floating around in you every day.
They're just out there. They're working, and you have the cool thing is when you think about like the white cells in the immune system is you're fighting little mini infections constantly, and
Every
you don't
day.
even know about it.
No.
You have
All
no
day.
idea until they get overworked and they start to lose the battle a little bit. That's when you start to feel crummy, and you don't. Then you're like, oh, maybe something's wrong. But every single day, they are cleaning up cancer cells. They are cleaning up rogue cells. They are cleaning up infected cells, and you have absolutely no clue.
None. They're, again, kidneys, unsung hero of the organs, the white blood cells, unsung hero of the body. Everybody thinks the red cell's awesome. It carries oxygen. It's got one job.
That's all it does.
One job.
Just transports oxygen.
These guys are out there saying, like, I'll keep you alive.
They're like a whole little network system working together and just keeping you alive.
Yeah, they're really cool. So if you're alive today, think of white blood cell
And your kidneys.
in your kidneys, unless you have
And your
leukemia.
bones.
But yeah, so white blood cells, they're
Yep.
pretty awesome. If you followed along with this podcast and you got excited about this, welcome to being a nerd, because that's what I just realized.
Every Friday, I'm like, good Lord Almighty, I'm a nerd.
Yes.
That's okay.
Definitely. But yeah, so really cool. For those of you that actually stuck around for this whole thing, welcome to the Nerd Club. We should get some t-shirts that say, I'm a nerd.
Yeah.
If your horse is alive, think a nerd. Because I think if you're going to be a vet, you better be a nerd.
Thanks, nerds.
Yep. So thanks for listening today. Hope everybody kind of stuck with us on this old journey down the white blood cells. I really like them. I know you do.
Yep.
I get pretty excited. So maybe one day we'll get some Matchbox cars and some Army tanks. And
Oh, yeah.
we'll do an overhead view and we'll get like a whole like battle getting fought out here on the table, and we'll get some generals in there, and like, yeah, it's gonna be awesome. Like snipers. It really is an all-out war in your body all day, every
All day
day.
long.
So
When it works really, really well, and you don't even know what's happening.
Yep. And when it goes haywire, you feel like crap.
Mm.
I really think this is where man flu comes from. It's our immune system is just so amazing that when we finally do get taken out, it's just bad.
Okay. I see how you spun that one. Yeah.
Yeah, man flu. It's real. It's real.
Mm-hmm. Yeah.
Men are truly amazing. We can lose a digit and we'll like put a Band-Aid on it and keep going. But Lord, if we get the sniffles, if an NK cell shows up and like starts giving us the sniffles, we're down for the count, order the casket, not going to make it. Like we're done.
Oh,
So,
gosh.
NK cells and men, they don't get along.
They don't.
So, well, thanks for being here today. Thanks for recording this for all of our listeners out there. We really appreciate y'all listening along. And for all the customers out there with horses, thank you for not making us get a real job, because I don't want a real job. I want to keep being an equine vet, and I love this. This is fun. So, April, thanks for recording all this and keeping us straight. Casey, thanks for editing all this, because Lord knows we'll get sidetracked and you got to pull some stuff out.
I
So
wondered if she edited out the pirate ships last time.
I love pirate ships. That's like if I win the lottery, I'm getting my pirate ship. I don't even know how to sail it, but if you win the lottery, I'm sure you can hire a pirate to help you sail around. So, but yeah. So thanks for listening, and from all us here at Countryside Equine, hope you'll have a great week. And yeah, if your horse is healthy, think the white blood cell.
Yep.
Take care.